Medicine has advanced significantly over the last century. Many illnesses that were once fatal, such as influenza, are now preventable and treatable. However, to understand how we arrived at this point, we must examine the past. In particular, let us return to 1918, when influenza was widespread and ravaging the world, and learn how it has shaped the future of medicine. Towards the end of World War I, a new killer was unleashed. The Spanish flu became one of the deadliest pandemics in modern history, causing over 50 million deaths worldwide.
According to Dr. Karen M. Sorgo, especially in infectious diseases from Temple University, the influenza virus was not the only culprit. But what else could have possibly caused these deaths?
Aspirin was
patented in 1899 by a German company called Bayer. But when the patent expired in 1917, other companies began selling their own. Because aspirin was over-the-counter, inexpensive, and widely produced, the U.S. military began to use it, and eventually the general population did as well, believing it was a miracle drug. Besides reducing headaches, fevers, and arthritis pain, there was little information about the effects of aspirin. More importantly, people didn't know the safe dosage for aspirin. The American Medical Association, U.S. Navy, and U.S. Surgeon General recommended daily doses of anywhere from 8,000 to 31,200 milligrams.
which is toxic compared to today's daily recommended maximum of 4,000 milligrams.
So how are drugs dosages determined today? The U.S. Food and Drug Administration require new drugs to go through clinical testing, which includes 3 phases to ensure their safety for use.
The first phase of clinical testing consists of testing for dangerous side effects of a drug. The second phase is when drug dosages are determined. A drug dose refers to amount of drug administered at a time. The doses doctors prescribe can vary depending on factors like age, sex, weight, height, and if they're taking any other drugs. When considering giving new drugs to people already taking drugs, doctors have to consider whether the new drug would have an effect or not on the existing drug. Lastly, the third phase determines how it compares to existing treatments.
The FDA requires the creation of drug labels. Labels must contain details about dosages, side effects, food administrations, when to take it, and another important information. Today, the FDA has strict rules about the use and regulation of drugs, a stark contrast to an early 20th century. Over the past few decades, information about drugs dosages has drastically evolved and continued to as medicine as ever expanded field.